Hi, my name is Aimi Sakina and today I'll be sharing about refraction in low vision patients using method of JND, just noticeable difference. So, refraction is one of the steps in clinical evaluation and the goal of subjective refraction is to achieve the best possible, clear and comfortable binocular vision. Refraction in low vision patient is not simply the matter of asking the patient to discriminate clarity between two lenses, but the integration of the following measurements and information which direct the examiner towards the refractive error and finally the lens prescription. A careful refraction is the most important test in the sequence of the low vision evaluation. Therefore, obtaining a good and accurate refraction in a low vision patient is extremely important because this is the starting point for prescribing any low vision devices. Clinicians must remember that the standard refraction techniques are employed when performing a trial frame refraction on an individual with normal sight, and JND refraction techniques are used for those who are visually impaired. When practitioners use JND refraction techniques, they are able to do accurate refraction at any acuity level. So, what is JND? So, JND stands for just noticeable difference, and it is the amount of lens power needed to elicit an appreciable change in clarity or blur. The poorer the visual acuity, the larger the JND. It means that a patient having low VA needs more spherical power to differentiate the difference of blur and clear. JND power is determined by taking the denominator of the 20-foot Snellen acuity and dividing it by 100. For example, a 20/150 will be sensitive to a lens change of approximately 1.5 diopter using the JND rule. JND refracting techniques apply to both sphere and cylinder correction. Most importantly, JND elicit reliable answer from the patient. So, how do we actually calculate the JND rule? Let me teach you. Firstly, to calculate JND, we must use the visual acuity in 20-foot Snellen letter acuity. For example, the situation is a patient with 20/150 acuity. What is the JND? Simple. So the patient's acuity is 150 at 20 feet. So divide 150 by 100, which equals to 1.5 diopter. 1.5 diopter then divided by 2. This equals to 0.75 diopter. Then put plus minus in front of 0.75 diopter, which means that the patient would have an initial of clarity of plus 0.75 and minus 0.75 around his or her best correction. The method is to just divide the patient's acuity by 100, then divide it again by 2, then you will get the patient's JND. Simple. So in JND refraction technique, remember to always decrease the power interval as visual acuity improves. This means that we should always check the patient's VA and change the JND lenses. Then use tri-frame refraction when visual acuity is 20/50, which means 6/15, or worse if regular refraction technique are not working. So, remember the importance of refraction because the only intervention needed to enhance visual functioning might be just to prescribe appropriate glasses. I'll be teaching you the JND procedures more in details in the next video. For now, that's all from me. See you in the next video. Thank you for watching. I'm Sakina signing out. Bye!